Can anarchism address issues of addiction and substance abuse? It's a complex question, but one that's worth exploring. Anarchism, a political philosophy that emphasizes individual freedom and the elimination of hierarchies, has often been associated with counterculture movements and alternative lifestyles. But can it offer solutions for the growing problems of addiction and substance abuse in our society? Firstly, it's important to understand the root causes of addiction and substance abuse. While genetics and individual choices certainly play a role, social factors such as poverty, trauma, and lack of community support also contribute to these issues. Anarchism's emphasis on mutual aid and community support could be a powerful tool in addressing these root causes. By promoting a society in which individuals are not subject to oppressive hierarchies and are able to support one another, anarchist principles could help create a world where addiction and substance abuse are less prevalent. Moreover, anarchism challenges the capitalist system that often fuels addiction and substance abuse. In a capitalist society, profit is prioritized over human well-being, and the pharmaceutical industry is no exception. The opioid crisis in the United States, for example, was largely driven by pharmaceutical companies aggressively marketing highly addictive painkillers. Anarchist principles could help combat this by promoting a society in which healthcare is a right, not a commodity. By dismantling the profit-driven healthcare system, we could create a society that prioritizes patient well-being over corporate profits. Anarchism also promotes harm reduction strategies rather than punitive measures. In a world where addiction and substance abuse are criminalized, individuals are often punished rather than helped. Anarchism's emphasis on individual autonomy and non-coercive solutions could help shift our focus towards harm reduction strategies such as safe injection sites and access to clean needles. These strategies have been proven to be effective in reducing the harm caused by addiction and substance abuse, but are often met with opposition due to moralistic and punitive attitudes towards drug use. Lastly, anarchism's focus on intersectionality could help address the disproportionate impact of addiction and substance abuse on marginalized communities. People of color, LGBTQ+ individuals, and low-income communities are all more likely to experience addiction and substance abuse, yet are often ignored in mainstream discussions of these issues. Anarchism's emphasis on the interconnectedness of various forms of oppression could help bring attention to the ways in which these communities are particularly vulnerable to addiction and substance abuse. In conclusion, while anarchism may not provide a complete solution to the complex issue of addiction and substance abuse, its emphasis on mutual aid, harm reduction, and intersectionality could offer valuable tools in addressing these issues. By promoting a society in which individuals are free to make their own choices, but are also supported by their communities, we could create a world in which addiction and substance abuse are less prevalent.